And there was only one place to me to work, and that was in the ER. And I really, really enjoyed that. And for 38 years, that's all I did was ER, 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 ER. We saw a lot of patients come in with back pain. My whole career, I would never, ever advocate anyone, my family, my neighbor, anyone, to have back surgery, because I had not seen one case where back surgery ever cured or improved the life of anyone else, because I saw all the bad stuff. Over the years, my back had deteriorated from lifting patients and the strains of life. And as it turns out, now I'm in that age bracket. I had the weak back, I had pain, and I had to have something done. I went to see Dr. Fahim at the Michigan Head and Spine Institute.
I will never forget when I first met Paul in my clinic. I don't think I've ever seen anybody so terrified to meet a neurosurgeon. And I guess that was because of all his years working in the emergency room, seeing patients who had had old-fashioned spine surgery who hadn't done very well.
I really liked Dr. Fahim. The minute he walked into the room, he had this air of confidence. He explained everything, what was going on, what he was going to do.
So it took a few minutes to put him at ease and show him that the type of surgery that I do on patients' spine is minimally invasive and is not the same as the types of surgeries that he's seen his patients have when they came into the emergency room and he cared for them as a nurse.
I had this skewed version of back surgery.
He had a pretty simple herniated disc. And in the old-fashioned era and the old-fashioned way of performing spine surgery, you would perform an open operation, which involves a lot of destruction of some of the ligaments and muscles and tissues and some of the bones and some of the surrounding structure of the spine, which can leave the patient in a lot of pain or have problems down the road. But I like to perform these operations in a minimally invasive way, which minimizes destruction to the surrounding tissues and the surrounding bones and ligaments and muscles, and patients make an incredible recovery, and they recover very quickly with minimal post-operative pain.
And when I woke up from surgery, I was pain-free. I thought that they didn't do the surgery because I felt nothing. I mean, I could move, I bent forward, I had absolutely no pain, and I thought, this is incredible. So I'm laying around in bed, and I'm not good at laying around in bed. I was laying there watching TV, and in the room there's two clocks. One clock didn't work. I'm familiar with hospital beds, so I undid the side rail. Don't do this at home. Got out of bed. I scooted the chair over to the wall underneath the clock. I climbed up on the chair and stood up, reached up, got the clock off the wall, turned the little black knob on the back and set the clock, put it back up there right, got back down, got in bed. Not a twinge of pain.
I meet so many patients who have heard terrible things about spine surgery, and it takes a little bit of time to kind of educate them about minimally invasive spine surgery and how their outcomes can be very different from people they know who've experienced spine surgery. As I always like to tell my patients, this isn't your father's back surgery. Times have changed, and our techniques have changed, our technologies have improved, and our surgeries are better. Patients recover faster with less pain after surgery, and they're able to walk, they're able to exercise, they're able to do all the things that they want to get back to doing faster and pain-free.
It's really ironic that I spent my whole life deterring other people from having back surgery. And now when it came my turn, I had back surgery, and it's just unbelievable.